Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Welcome to KOCT, Community Health Matters. My name is Vicki Beck, and today I'm talking to staff at Vista Community Clinic. For more than 4 decades, VCC has been well known in North San Diego County for affordable, high-quality primary care, women's health, pediatrics, and dental health. Each year, more than 58,000 patients receive care at 5 state-of-the-art sites in Vista and Oceanside. In 2015, VCC took a bold step forward. To improve services, they've added specialty care. Patients can now access behavioral health, optometry, and chiropractic care in the comfort and the convenience of their own medical home. My first 2 guests are members of the behavioral health team. Dr. Deborah Steinberg is a psychiatrist, and Carolina Ramirez is a licensed clinical social worker. Welcome to both of you.
Thank you.
Dr. Steinberg, I'll begin with you. Can you define the term behavioral health and tell us why it's such a critical component of a person's overall health and well-being?
Behavioral health is care aimed at treating the way a person thinks, feels, and deals. And I am quoting our behavioral health director, Dr. Donna Mills. So by thinking, we are addressing issues that involve people's cognition, their ability to pay attention, and their ability to learn and focus. By feeling, we are addressing mood issues, anxiety issues, and by dealing, we are addressing the ways that people cope with things that happen in their lives, such as loss and trauma.
And certainly all of us have stress.
Yes.
And face challenges in everyday life. So how do patients benefit by receiving this type of care in a primary care setting?
Well, to start off, it is much easier to access if you are able to access these services where you get your routine medical care. The other thing that is really advantageous is that this way the team can really treat the whole person, so that patients aren't getting one part of their treatment in one place and another part in another place. Another advantage is that we share a medical record, and while many aspects of behavioral health care are kept in a more confidential fashion, it also means that we as behavioral health care providers have access to what is happening in a person's medical care, and to some extent vice versa. And this allows us really to treat the whole person.
So it sounds like what you're saying is that the person's medical care and behavioral health care are quite linked.
Very much so. So we know that a person's behavioral or mental health very much impacts their physical health, and vice versa. So these 2 aspects of healthcare are completely intimately intertwined.
So what types of conditions are you seeing in patients?
We treat people with mood disorders, so that would include depression, sometimes bipolar disorder. We treat people with anxiety disorders, which would include generalized anxiety disorder, OCD, panic disorder. We treat people with post-traumatic stress disorder, and we treat people with disorders such as attentional deficit disorder and other disorders involving ability to think and focus.
And how does a patient know when they have depression? Because many times we hear people say, "Oh, I'm so depressed today." How does the patient know when it's time to seek help?
If someone is struggling with mood issues that are lasting more than 2 weeks or so and are significantly impacting their ability to function in their daily life, then it is time to seek help.
And can a patient call the behavioral health team directly, or do they go through their primary care physician? How does it work?
Generally speaking, they would go through their primary care physician at Vista Community Clinic to get a referral.
Okay. Carolina, I'd like to ask you a couple of questions about the role of the licensed clinical social worker on the behavioral health team. What do you do in that role?
The LCSW is a clinician. We are skilled at identifying and treating behavioral health conditions. We are really a behavioral health consultant for our patients, but also for our primary care providers. So any time that the primary care provider identifies a psychosocial concern that may be affecting the person's medical condition, a referral is made, and then we meet one-on-one with this patient in order to identify the best treatment goals.
And what are some of the services that you offer a patient who's facing a mental health crisis or other issue?
Vista Community Clinic provides non-emergency behavioral health services. In any situation when a person is experiencing a behavioral health crisis, we strongly recommend reaching out to the San Diego Access and Crisis Line. Their number is 1-888-724-7240.
You want to repeat that again? It's 1-888.
724-7240.
Okay.
They are available 24 hours a day, 7 days a week. Additionally, if somebody is experiencing a crisis, they should call 911 as another option or go to their nearest emergency room. For the clients who are at Vista Community Clinic, if they are experiencing a mental health crisis, we do engage in a thorough assessment, and under some circumstances, we may facilitate a transfer to the emergency room. For those instances when we meet with a patient of ours on a regular basis, normally the LCSW completes one-on-one visits, which are generally short-term, very targeted, and we address issues regarding depression, anxiety, perhaps change in their life situation, or anything related to even management of a new diagnosis or health behaviors that are affecting their medical condition.
Let me ask both of you this question. Perhaps you both can shed some light on this. Mental health has had a bit of a stigma in the past where people feel like it's not a good thing. You don't want to admit that you have a mental health problem. So how is that being addressed today? Are patients still hesitant to seek care, or do you find that people are much more enlightened and willing to go and seek the care they need? Dr. Steinberg.
I find that generally speaking, people are willing to come in and get mental health treatment. I do think that there are certain cultural groups where maybe there is still more stigma attached to the idea. What I think is helpful to think about is that mental health illnesses are no less medical illnesses than what we traditionally think of as medical illnesses. So for example, depression is no less biologically based than diabetes. So that,
and what do you mean by that? No less biologically based?
What I mean is that it is equally centered within the body and the chemistry and the physiology. Depression is equally centered there as diabetes. So in other words, these are medical illnesses. Even though we label one mental health and the other medical, they are both really medically treatable illnesses.
So we're actually talking about brain disorders.
Exactly.
And the brain is a major organ of the body.
Absolutely.
Okay,
and
no
one is responsible for either of these type of illnesses occurring. They just happen. So I think we have a tendency to blame ourselves if we have an emotional disturbance when really we are no more responsible for that than we are for a medical illness.
Thank you, Dr. Steinberg.
Sure.
Thank you, Carolina Ramirez, for being with us. After the break, I'll be talking to Dr. Jaime Cortez, who is in chiropractic services at Vista Community Clinic.
When I was 6, I had one thing on my mind. When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T.
F face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery.
Protect the ones you love.
Spot a stroke. F-A-S-T, fast.
Welcome back. My next guest on this segment is Dr. Jaime Cortez, who is a chiropractor at Vista Community Clinic since July 2015. Welcome, Dr. Cortez.
Thank you, Vicki.
Many of us know people who have seen a chiropractor, or perhaps we've seen one ourselves, and usually it's to seek some relief from pain. Can you talk about the way that chiropractors work with patients in order to alleviate their pain?
Absolutely. The role of a chiropractor is to use alternative methods to help alleviate physical ailments. What I mean by that is we use techniques with our hands, adjustments. We use different therapeutic tools, whether it's ultrasound, electrostimulation, muscle work. We use those tools to help the body heal itself. I mean, that's the main philosophy of chiropractic, is to essentially get the body to restore function.
And how do you evaluate a patient when they come in? Are you using those tools for evaluation as well?
In general, what I like to do is have a patient come in and tell me their story. Tell me exactly what's going on. The best tool I found is listening to a patient. When you kind of go in and, you just see the patient and you say, oh, I know what's wrong with you, don't worry, I'm going to fix you. Generally, you have to listen to the patient. They're going to tell you, this happened to me however many years ago. This is something that's been bothering me. I work here, I do this, I do that. So if you listen to the patient, it makes that much more, easy of a correction.
Sure. And what are some of the most common conditions that you're treating?
Boy, I mean, the list goes on. I mean, the headaches, chronic neck pain, shoulder problems, back pain, knee problems, ankle problems. With the advent of new technology, you see a lot of people with like thumb issues, wrist issues because they're holding their tablets. They're on their phones, texting. A lot of also, chronic headaches. I mean, headaches is probably one of the biggest things that we see there. Anything from migraines to just headaches that plague people constantly.
So does the patient generally see their primary care physician first for this type of a problem? Or do they come directly to you at the clinic?
We set it up so that the patient wouldn't have to go through the referral process. Basically, an easier way for a patient to come in and seek treatment and get better. The more obstacles you put in front of a patient, the less likely they're going to seek the treatment. And
how receptive are they to making appointments and coming into a chiropractor?
It's been an overwhelming response. And I say we, myself, I mean, we are busy from, the time I get there to the time I finish. Because, the difference between working at a community clinic is that many of our patients don't have access to great insurance or have access to being able to pay a normal office visit. So the population is low income, and it has been a massive response to it.
Who benefits most from chiropractic care? Are there certain age groups, men, women, people with more severe problems?
I mean, it's a question that I can, honestly say everybody can benefit from chiropractic. I have patients in their 90s. I have patients that are small children that come in, and in between. Everybody has had some experience, whether it's a slip and fall, it's a car accident, daily living, their job, just something, and with my background, I also have experience in nutrition, also, in muscle work, exercise type things. So basically, there's a whole population out there that can see chiropractic care.
Well, nutrition interests me because I don't think of that as
Right.
something that a chiropractor would offer. So tell us a little bit more about that.
So the science is out there. Nutrition is linked to pain. So you have somebody who has a diet rich in whether it's fatty meat or fast food or just junk food in general, that it can cause inflammation in the body. Inflammation is linked to pain.
So do you then put patients on special diets
I
to
don't,
relieve pain?
I don't put anybody on a special diet. I mean, thankfully for the clinic, there are nutritionists there. What I do is I merely educate the patient on, maybe looking into certain the types of, if you want to call them diets, what certain foods can do to the body, and then, as a, kind of refer them to their primary care. And then they can be referred to a nutritionist.
So you said something about inflammation, and is inflammation the cause of some of this discomfort and pain? And you're saying that some foods cause more inflammation than other foods?
Absolutely.
So which foods? I think we'd all like to know that.
Generally, and the science is out there, like I said, simple sugars. Simple foods like, you could say white rice, you could say pasta, you could say all that, in excess. Okay. Certain meats we know, red meat, is a huge component of inflammation. Animal proteins.
So would you say that if people are aware of some of these foods and if they limit how much they take in some of these foods, that almost produces a prevention measure?
Absolutely, and that's my role, is to educate the patient by telling them to limit. I don't say, don't eat that. I say, you might want to limit some of that. Maybe that's the cause of the inflammation.
What about other prevention measures to avoid some of the most common problems that you see? What are you recommending to patients?
The basic is movement. A lot of people who have sore necks or backs will inevitably just stop doing what they're doing, become inactive, and that will in fact cause more pain in the body. So I will tell the patient, we need to get you out moving, and a lot of them will tell me, I can't, it hurts so much, and my role is to be sort of like a trainer, get them to say, you know what, certain uncomfortable discomfort is okay. You just got to keep doing it. Little baby steps, little baby steps.
So where do you draw the line between physical therapy? Because I think of physical therapy as a way to alleviate some pain as well, and then chiropractic. So when is chiropractic care more appropriate? Or is it in combination?
Yeah, I mean, as chiropractors, we're trained to be able to do therapeutic exercises. So a lot of my patients, I will give them some sort of physical therapy. I'll show them how to do certain stretches. I'm a very hands-on person. So part of the office visit is actually me demonstrating certain movements. I want you to start stretching like this. I want you to start doing this. So for me, I am somewhat of the physical therapist there.
And what strikes me also is that chiropractic care hasn't always been included in primary care. And this seems to be a very bold step in a very free-thinking, new approach to medicine. Can you comment about that and how that change has occurred?
Absolutely. I mean, chiropractic has kind of always been that, kind of in the back seat of medicine.
And what brought it forward?
It's I can't pinpoint exactly. All I know is that we are basically, chiropractors in general are popping up everywhere. The great thing about the clinic was this opportunity to be able to give back to the community, with my training, my education, and give back to a population that is sometimes, forgotten.
Well, thank you, Dr. Cortez, for being our guest today from Vista Community Clinic Chiropractic Services. After the break, I'll be talking to Dr. Ryan Rich from Optometry.
role, we help you help. Visit aarp.org/caregiving for information on how to provide even better care for the person who once took care of you.
Welcome back to Community Health Matters. My guest in this segment of the show is Dr. Ryan Rich, who is Site Director for Optometry Services at Vista Community Clinic. Welcome, Dr. Rich.
Thank you for having me.
Let's start with why eye health is so important for a patient's overall health, and who might be at greatest risk for eye problems.
Well, eye health is very important. It's very important to have routine eye exams, routine eye health exams, for many reasons. There's so many vision problems out there that can be caught if you just have your routine eye health exam. One example would be glaucoma. Now, glaucoma is a disease of the optic nerve, which is kind of the cable between the eye and the brain. Sometimes pressure inside the eye causes you to lose some of that nerve fiber. Losing that nerve fiber, you would actually lose some of your peripheral vision. And interestingly enough, you have to lose about half of that nerve fiber before you would even notice a change in your vision. Whereas if you had a routine eye health exam, we can pick up on those changes quite early on with a routine eye exam. Now, glaucoma is a very treatable eye disease, so it's something that we do want to catch as early as possible. And that's just one of many examples of vision-threatening eye diseases that can be caught.
So glaucoma is usually diagnosed in people as they age, correct?
Most of the time, yes. There is something called congenital glaucoma, and that's usually caught pretty much right away, hopefully. But yes, it's known the later stages in life, and it's very genetic too. So if somebody else in the family has glaucoma, probably a good idea to get checked, quite often.
And how often do you recommend eye exams for people at different ages and stages of life?
The American Optometric Association actually recommends your first eye exam at about age 6 months old. That's actually because there's a few conditions out there that are congenital that we want to catch right away. A very dangerous condition would be a tumor in the eye. There are some tumors that are common to children that are not only sight-threatening, but they're also life-threatening. So that's why we recommend having that first eye exam that early on. The next eye exam about age 3 years old, and then after that about 5 or 6. Basically before starting first grade, that's an important time to have your third eye exam. And then if everything's healthy, every couple of years after that is usually okay.
Do you see many children in your practice at Vista Community Clinic?
Yes, we see quite a lot of children. Now, we see children at 3 and up in the vision clinic. So that first eye exam at 6 months old, we recommend seeing an outside provider, a pediatric optometrist or ophthalmologist.
So are children put through the same screening process as adults with the letters and reading the alphabet?
For the most part, yes. There's a lot of children that, especially at age 3 and 4, a lot of them can't see letters, so we use shapes instead of letters. And a lot of them can't also tell us, when we say which one's better, 1 or 2, sometimes they can't articulate that. So we have to do a lot of objective testing in those patients. So we can actually get a pretty good idea of somebody's overall health and their overall prescription for their eyeglasses without them even saying a word.
And are you picking up on any conditions that require more than eyeglasses, that might require another type of treatment?
Yes, absolutely. So at Vista Community Clinic, we see a whole wide array of conditions. People come into our clinic for as simple as needing an eyeglass or contact lens prescription, to coming in for an eye injury, to infections, so like pink eye, eye diseases. So as optometrists, we're qualified to diagnose and treat a whole wide array of conditions and diseases. However, if they require a specialist or require surgery, like cataract surgery, we do supply them with referrals to that specialist.
Okay, and what are some of the screenings that you're doing, specific screenings, looking for certain things at certain stages?
Well, we're screening for pretty much any condition. I was saying earlier about how your overall eye health is actually connected to the rest of your body. So pretty much any systemic disease that you can have, any disease throughout the body, usually manifests in some way inside the eye. So for example, diabetes. So diabetes is a very common condition, especially at Vista Community Clinic. Unfortunately, we actually have a lot of diabetics who have uncontrolled diabetes. But what we see is leaky blood vessels. Now, the first vessels affected in diabetes are the very small ones, like the ones in the back of the eye and the ones in the kidneys. So if there's bleeding going on in the back of the eye, which by the way causes permanent eye damage, usually that's also going on in the rest of the body. So with patients like that, when we see that, we make sure that we give them plenty of education, make sure you're taking care of your diabetes, make sure you're checking your blood sugar, taking your medication, and following up with your primary care provider as they recommend.
So for some patients with specific diagnoses like diabetes or maybe even HIV,
Sure.
Are you seeing them because you know they're at greater risk and they come in more frequently?
Absolutely. So, you know, if you don't have any eye conditions and you don't have any systemic conditions and you're a healthy person, usually every couple of years for a routine eye health exam is good. But yes, if somebody has, you know, condition like high blood pressure, or diabetes, or HIV, they are at greater risk. And, you know, if I don't notice any damage in the back of the eye with their systemic condition, I'll probably recommend every year. But if I see that there's some damage, most likely I'll see them back more often. Or if they require surgery, I will refer out to a specialist.
Well, let's talk a bit about prevention of eye problems. As we get older, we certainly are more vulnerable to all types of eye problems and other problems. But what do you recommend to patients in order to protect their eye health?
I was kind of alluding to it earlier. It's just, you know, preventative eye health exams. So, you know, the annual eye exam if you're at risk, or you know, less often, you know, every 1 to 2 years if you don't have any issues. It's all about trying to catch those problems before they become a problem.
What about empowering the patient to take care of his eyes on a daily basis through his lifestyle habits? Is there anything that you're recommending that would be a good practice so that he can avoid eye problems?
You know, honestly, the biggest one is just those routine eye exams. I mean, if I see somebody that doesn't have an issue, and, you know, it's hard to actually, as a patient, to realize that something is going on with your vision, because a lot of times people don't realize they have a problem until they come in to see me. One of the biggest things I see is somebody comes in and they say, nope, I have no problems. I'm just here for a routine eye exam. And then we cover one eye and they say, oh my gosh, I can't see out of that eye. Well, both eyes open, you know, it's hard to notice things. And people don't walk around doing this, you know, until they come in and see us.
Well, what I'm getting at, I think, are a couple of things here.
Okay.
One is that I've seen my husband reading books and not turning on a light.
Okay.
And I'm thinking, isn't that going to harm his eye health? I mean, you have to protect your eyes in some ways. The other is that there are a lot of vitamins on the market now.
Sure.
Supposedly to decrease risk of macular degeneration.
Okay. So as far as the light off for your husband, most likely he's probably not hurting his vision.
Okay.
You
That's
know,
not what I wanted to
I
hear.
know. You know, a lot of parents come in asking me to please tell them, you know, my kids shouldn't be playing video games and things like that.
Right.
But
What
honestly,
about the vitamins?
Now, as far as vitamins go, there's been a lot of studies that have been done as far as taking those extra vitamins, vitamins high in lutein and zinc and zeaxanthin and things like that.
What's the bottom line for you?
Honestly, I don't think you need to take any extra of those medications or any of those extra vitamins unless you have a condition like macular degeneration.
So maybe just a very healthy diet.
Yeah, however, a very healthy diet is very
Including
important.
what?
Diet high in those deep green vegetables. Those have a lot
Carrots?
of carrots. Great with the beta carotene. Absolutely.
Just like our
good for
mother
the eyes.
told us.
For
So
sure.
we do need to eat our green vegetables and our carrots.
Absolutely.
Thank you, Dr. Ryan Rich, for being with us. This brings us to the end of our show on specialty care services at Vista Community Clinic. Thanks for being with us on KOCT Community Health Matters.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.